welcome Mayor London Breed.
Thank you. Good morning, everyone. I'm San Francisco Mayor London Breed. Thank you all so much for your patience. Today, we have a total number of 9,544 cases of those who have been diagnosed in the past 6 months of COVID here in San Francisco, with sadly 83 people who have died. This is, as I constantly say, a fluid situation. And we remember just recently, as I reminded folks at the last press conference, of course, that one day we were talking about a phased plan, and then the next day we had to make significant changes. More recently, we had a level of confusion between state issued guidelines and local guidelines. And I want to be clear that we are definitely working and communicating with the state. I just believe that there was a level of confusion as it relates to what we were doing here locally because of our numbers and because of our public health officials. And so what we try to do is provide you the most up-to-date, most accurate information. It's important that you visit sfgov.org, the Department of Public Health, the website, to find the latest in guidelines. But there are certain things that we've repeated over and over again that we are at a point where those are the kinds of things that we should just automatically do. And that, of course, includes making sure we are wearing our masks, that we are social distancing, that we are doing our part, because what happens is there are a lot of, questions asked of me and so many other leaders in the city. The biggest question is when? When can I open my store? When can my kid go back to school? When can I do this, or when can I do that? I mean, I understand the desire. I have those same desires. And the only way we are going to get to that place is if we all do our part. And so today, we want to just talk a little bit about where the city is, a new phase of reopening because of where the city is, but also just a reminder that just because this happens doesn't mean that we unfortunately can't pull things back if we see a surge. Labor Day weekend is coming up. I know everybody is thinking, well, this is a time I miss my family. It's been 6 months. Here's an opportunity for us to get together. That is highly discouraged. Highly discouraged. Especially if you want your kids to go back to school sometime soon. Especially if you want to visit your elderly parents in the senior home that probably doesn't allow visitors still. Especially if you need to reopen your shop and get back to work. So as we approach Labor Day weekend, it is so important that we remember that in those family and friendly gatherings that occur, that's where we are seeing through our contact tracing efforts where the spread happens, where we run into problems. We saw it during the 4th of July weekend. There was a spike. We've seen it during holiday weekends, and we understand the natural desires of human nature to want to connect with other people. But we got to get through this. We got to get through this. Dr. Colfax will go into details a little bit more about what's happening in the city. We are still, based on the state system that has been established, that the governor announced last week, we are still in the red category. And we want to, of course, move away from that as much as possible, but it doesn't mean that we aren't able to move forward and to provide guidance on when we expect to reopen. So the fact is we are off the wait list, which is a good thing, but we are not out of the woods. So we got to keep that in mind. As of today, we know that things like haircuts and outdoor hair salons and nail services and massages can resume. Outdoor pools can reopen. We know this is not what people wanted. I sure don't want to get my hair done outside, I want to be honest, so I get it. But this is what we have to offer. We also said that, as of today, that gyms can open, outdoor gyms as well, but we are still working with the gym community on the guidelines to make sure that they are prepared. So most likely, September 9th would be the first opportunity that could be available. And another thing, after being removed from the state watch list, malls were open before we were on the state watch list. And the good news is, as of today, malls can reopen. They can reopen because we are no longer on the state watch list and because they were open previously before we were placed on the state watch list. Now, I also have heard that there's been a lot of talk about not knowing what the guidelines are for various businesses. And I want to direct any business, any community, anyone who's uncertain about what they need to do to sf.gov/reopening. There is not only a laundry list of guidelines for various businesses, there's information that you can review so that you can be prepared even if your business is not open at this time. So you don't have to wait until these announcements occur. You can get ready before the opportunity is available to your business. Now, the path forward is good news, but again, we have Labor Day weekend coming up. We have, real concerns because the more we open, the more people are gathering and spreading around, and we still have concerns. But we want you to do this responsibly because we want to make sure that we see these businesses continue to be open. So all plans are subject to change, just like they were before. The last thing I want to do is tell you that we're going to be opening and then need to make changes and to start closing businesses once again. It's the last thing I want to do. But the good news is, starting mid-September, hotels for tourism and visitors, outdoor movie theaters and other outdoor family entertainment like mini golf, outdoor tour buses and boats, indoor museums, zoos, and aquariums with approved safety plans. Houses of worship will be able to allow individual prayers and outdoor services for up to 50 people. And that will begin mid-September, and we'll be able to provide the specific date once we have confirmed the date and make sure that we're in touch with those various businesses with the appropriate guidelines. So the end of September is, I think, really good news. So this is something we should all be working towards. And what that means is a sacrifice of another month of masking and socially distancing and doing everything we can so that we can get to a place where we can have indoor personal services. We can move our hair salons, our nail salons, our barbershops, and our massages by the end of this month indoors, which is incredible if we continue at the pace that we are now. And we will be able to allow tattoo and piercing and increase places of worship access, 25% capacity indoors with no more than 25 people and 50 people outdoors. Indoor one-on-one personal training services with our gyms. And again, all of these must be done safely with mask wearing because that's critical to the success of not only opening these establishments, but allowing them to remain open. So the path forward for schools. And I just want to be clear that, as mayor, I am, of course, very, very supportive of our schools, our kids in particular, and wanting them to learn, to grow, and to thrive. And what we have seen this year with our students, especially those students who may not have parents or grandparents or family support to help them in their lessons, even when we've provided them with devices and internet service, they are still falling further behind. It's why it was so important that we open these learning hubs, and we are almost at capacity. We know how vital it is that kids have access to people who are able to help them with their lesson plans. I'm extremely concerned about the future of our children as we continue with COVID. So that's why we have to make prioritizing the ability to get our schools reopened, we have to put that at the forefront. We know that it's not as easy as we can open the schools. We know there are teachers and educators that are concerned. We know that we need to put together plans. We know that it is not my decision, but the decision of the school district to move this forward. And my plan is to do everything I can to work hand in hand with the school district so that we can move forward and get kids back in school as soon as it is safely possible to do so. So starting in mid-September, we'll have community learning hubs. K through 6 schools that have submitted a health and safety plan through the waiver process will be able to open. And again, I want to be clear, there's a process and it's their decision. But we want to be clear that the opportunity to move forward with K through 6 is possible. After that work towards getting the following open by mid-October, after that, the goal is to take it to the next level, and by mid-October, K through 6 schools that have not been part of the waiver process will be allowed to be a part of the waiver process again, and will be able to determine whether or not they will be able to open, and middle schools through 8th grade. High school students transit similar to adults, so we are being very cautious, and we are not certain that we will be able to move forward with high schools anytime soon. But all of this, again, has everything to do with the numbers, with where we are, with what's happening as we open more businesses, as we start to move around San Francisco like we haven't before. So we all will play a role in the success of what we do moving forward. I can't reiterate that enough because you all have been a part of stopping the spread at one point. When we first started this journey 6 months ago, this city was like, it was praised. It was praised because of our fast action and because of the people of the city who played a role in doing everything you could to not only stay home, but to also support your neighbors and to support one another. 6 months later, I'm tired of it too. I'm tired of living like this too. I understand how you feel. I can't imagine what parents are going through or people who are caring for elderly parents. But you know what? We all have to sacrifice. We all are going to have to sacrifice to get through this. As I said, if we want to move to the next level, if we want to get kids back in school, if we want to keep the business that we grew up going to open, the businesses that rely on us every single day, if we want to keep them open, all of us play a role. So I want to thank you all so much for your cooperation. I know it's Labor Day weekend. I know it's tempting, but please just keep in mind that this virus is still out there and we need everybody to play a role in making sure that it doesn't continue to spread. And as we reopen, we don't want to see those numbers go back up, which will force us to take a different direction. That is the last thing I want to get out here and say, is that unfortunately, I told you yesterday that we were opening, and I'm telling you today that we have to close because of the numbers. That is the last thing I want to do. So keep that in mind as we move about our day-to-day activities. This is really great news for those small businesses, especially those personal services that I know are struggling to survive. And so thank you all so much for your cooperation and your work. And at this time, for a detailed public health update from the Director of the Department of Public Health, Dr. Grant Colfax will join us.
Well, good morning, everyone. Thank you, Mayor Breed, for all you do for this city every day. I am Dr. Grant Colfax, Director of the Department of Public Health, and I'm happy to join the Mayor and Assessor Recorder Carmen Chu, co-chair of the city's Economic Recovery Task Force, to discuss San Francisco's path forward towards recovery. As the Mayor just explained, the state has removed many of the restrictions that had previously prevented us from reopening low-risk activities and businesses. And so, while we have managed the impacts of the virus better than many other cities and counties, for example, we have one of the highest testing rates of any city in the country. And given our rates of infection, we thankfully have one of the lowest death rates in the country. Both of these while being one of the densest cities in the country. And we still need to move forward with deliberate and gradual reopening as our infection rates remain high, as do our hospitalizations. While they have thankfully gone down over the past few weeks, we still have one of the highest hospitalization rates in the region. And of course, we are continuing to monitor the virus in our community and adjust and adapt our response as needed. We continue to have a high positivity case rate, and this continues to disproportionately impact our Latino community. Today, in San Francisco, we have 9,544 confirmed cases of COVID-19, and over half of those cases are diagnosed in the Latino community. We have made progress, but there is much more work to do, and this is a priority for the Department of Public Health. And the reality is that we know more about the virus today than we did 6 months or even 3 months ago. We learn more and more about the virus every week, and we are able to analyze more data and learn more about the relative risk and preventive measures we all need to take to reduce and slow the spread of the virus. This information is so key as we continue to follow the science, data, and facts. These will inform our efforts as we open incrementally, so we can manage the spread of COVID-19 and sustain the progress that we've made. We continue to monitor the rules and limitations of the state's Friday announcement, but in San Francisco, we are placing an emphasis on our city indicators while deciding whether we can reopen more and at what pace. We must look at the local context. Remember, the state guidance is broad-brushed. It is meant to cover counties as small and as rural as Yuba or Alpine, but also as large and populated as LA, or as dense and urban as San Francisco. We will continue to be guided by our local health indicators, which track our COVID-19 cases, deaths, hospitalizations, contact tracing capabilities, and the availability of the all-important personal protective equipment. I want to provide an update on today's indicators from our data dashboard. The rate of new cases of COVID-19 remains high. We are seeing about 75 new cases every day right now and are still in the red zone. Our hospital system indicators, measuring the rate of increase of COVID-19 hospitalizations as well as the capacity of our healthcare system to respond, are in green, and indeed, that is good news. Our other health indicators remain solid. Testing is green. We are testing over 3,500 people a day, more than double our goal. Contact tracing is yellow and orange. We are reaching about 81% of cases and 77% of their contacts. While this metric has improved over the past few weeks, our goal is to reach 90% on both. And our PPE supply is at 100% of what we need for 30 days, placing us in the green zone. The gradual reopening of outdoor services, hotels, and children's activities means people will start to move about the city more, increasing risk and potentially community spread of the virus. And with more activities, we will likely to experience an increase in not only cases, but also hospitalizations. We will continually assess our new positive case counts and our hospitalization numbers. Our reopening pace will be informed by our ability to manage the risk of more activity that may result in more cases and, again, more hospitalizations. And reinforcing the mayor's comments, we need everyone to do their part, especially as we enter the holiday weekend. We simply must remain vigilant. And I know 6 months in, we are tired, but we must dig deeper and do our part. There is more virus out there than ever before. And indeed, we have a narrow window to keep moving forward. The most important thing you can do to slow the spread of the virus is to continue to take precautions. I thank you for taking these precautions in March, in June, in July, now, and in the future. Even in this time of uncertainty, especially in this time of uncertainty, it is important to remind ourselves and our neighbors that we do know how to slow the spread of the virus. Stay home as much as possible. Cover your face to help us all keep on track. Keep 6 feet apart. Wash your hands frequently. And please, do not go out if you are sick, and avoid social gatherings. We are in this together, and together we will get through this. In this evolving risk environment, we will bring back our communities and our economy the same way we continue to fight COVID-19, by working together. Thank you. And it is now my pleasure to introduce Assessor Recorder Carmen Chu, co-chair of the city's Economic Recovery Task Force, to discuss further San Francisco's path towards recovery.
Thank you, Mayor Breed, and thank you, Dr. Colfax. We were here not that long ago on Friday to share our plans for expanding our outdoor activities. We mentioned at that time that we would be back this week to talk more about forward plans as we think about other industries. As Dr. Colfax had mentioned earlier, and as the mayor had pointed to, our plan considers the restrictions and parameters that the state provides, but ultimately will continue to reopen based on our local health indicators. Today is important because it shows all of us what our path forward could look like. I want to take a moment to thank the public health team for all the work that they are doing to keep our San Francisco citizens, our residents, our workers safe. I also want to thank all of you for all of your individual actions that collectively have made a difference. Because of your actions, wearing a mask, keeping social distance, and making sure that you're taking precautions, we're here today able to talk about what a path forward could look like. I want to acknowledge how hard it's been. I think for many people over the last month and a half, it finally set in terms of how long this would go. Especially with the resurgence, I think many of us felt heartbreak that we wouldn't be able to move forward and that this might be here longer than any of us had hoped. We miss our family, we miss our friends, and we want to get back to work. More than anything, as a city first started down this path, when we first entered into shelter in place, when our emergency orders were announced, we were all here, and I think it didn't really settle into us about what this would all mean. What we did know was that this was going to be a situation unlike anything that we'd ever experienced before. Not only from a public health perspective, the fact that we are in the middle of an active global pandemic, but also that the economic impact would be so devastating and so quick. In just a few short months, unemployment went from under 3% to roughly 11% as we speak. There are still over 60,000 San Franciscans who are unemployed at the moment. So many of our kids are having a very hard time adjusting to distance learning. Our most vulnerable are continued to be isolated in their homes and other settings. And not only that, we've heard from so many businesses that they are hanging by a shoestring. In the beginning, we knew there was a lot that we did not know about the disease. We had a lot to learn about how it spread, its prevalence, what it would mean for people who had been infected, what effective treatments could look like. We know a lot more today. We knew then that we had to be flexible, and we also knew that we had to be transparent and share our approach with you in terms of how we want to communicate and how we want to share our reopening plans and getting our economy back on track. First and foremost, we committed to you to be transparent and to share information with you as soon as we know it, to be able to share guidance and good health best practices with you so that you can operate safely, so that you can interact safely. We knew that we had to let our data guide us, to make sure that we were careful about watching our hospitalizations, our case counts, our test positivity, and to allow that to guide our decisions about whether it was safe to reopen, to pause, or to take other action. We knew we had to be thoughtful in our approach, that we had to be incremental to make sure that we understood the impacts of the actions that we were taking, and we knew that this was important so that we can sustain the economic recovery and the progress that we make. It helps no one when we ping-pong back and forth, when we go and open and we close businesses, when people have to make investments that they have to pull back or won't be able to use. These things don't help our economy, they hurt our economy. We also knew that we had to focus on information and guidance. Ultimately, the safety of our workers, the safety of our customers' interactions matters when it comes to economic recovery. There is no economic recovery unless people feel confident re-engaging with our city and our city life. We know that we'll continue to provide immediate relief to our workers, to our families, to our businesses. We'll continue to be as flexible as we can. And through our words and through our actions, we're going to continue to break the narrative that it's a decision between public health or the economy, because the truth is, over the last few months, we know we need both. That's our continued commitment to you. I'm cautiously excited. I know that there are many cautions that we put out there. We hope that you continue to do your best, especially during this holiday weekend. But what I'm excited about is that this plan recognizes many things. It recognizes, number one, that we need to begin taking steps moving our economic activity indoors. We need to do it safely so that we can sustain the opening, as we mentioned before, but it really does begin to recognize what that path forward could look like. This plan also recognizes the importance of uplifting large and major industries in our city, including our hospitality industry. Thousands and thousands of people are employed in our hotels, in our restaurants, in our retail stores, and all of the different services that people come to visit and see and to experience. We can do that safely. We've shown the world that we can do this safely. Finally, I'll rest on this one thought. It's a refrain that San Franciscans have heard before, and it's this idea that progress isn't automatic. Again, I think San Franciscans are well accustomed and familiar with this call to action. We've heard it before in all of the civil rights movements that we've had, to know that while we make progress, sometimes we have to fight to make sure we don't lose ground. And that's exactly what we're facing with this pandemic. We know it can come back, but what we have shown in the last few months is that we also know how to beat it back, and that we also know that we can open businesses up together. So again, I want to thank you, San Francisco, for all of the work that you're doing to continue to help move our city forward, to make sure we're able to keep on opening in a sustained way, that we're able to do that in a safe way, to make sure that we balance taking care of our workers and our customers at the same time. Thank you, San Francisco.
We will now begin our Q&A portion with Dr. Colfax. Dr. Colfax, the first set of questions come from Aaron Alday with the San Francisco Chronicle. What have you learned about reopening and about the virus since May and June that you are applying to reopening plans now?
Well, I think we've seen in our local response, as well as across the country, that we can mitigate and slow the spread of the virus, keeping our hospital capacity adequate, and having enough capacity in our system to care for people who become infected. But the other side that we've also seen is we know that if we let down our guard, the virus can spread very rapidly. So I think it's really getting this balance between the need to manage the spread of the virus, and also realizing that there are key factors that we need to consider with regard to education, with mental health, behavioral health, and other public health considerations that we need to take into account in our reopening. We know that masking is so key. We know that more than ever, something that we have learned. A number of analyses have shown that if, as a society, we can get up to 80% masking, that will have a dramatic effect on the virus. So in the guidelines coming out, there will be an emphasis on the need for facial coverings in many of these engagements. We've also learned that outdoor activities are generally much safer than indoor activities. So outdoor activities, you see that in the phasing that we have, that outdoor activities that are expanded as of today. And we also understand the need after 6 months for children to come back into in-person learning as much as possible. So we think that that can be done in a safer way. There's always risk, but from what we've learned around masking, hygiene, and social distancing, and looking at the data globally, we will be making recommendations around how to move forward with the educational activities. So there's no such thing as no risk. Pacing is very important, which is why we continue to spread out this process of reopening, and we need to be cautious as we go forward.
Thank you, Dr. Colfax. The next question is from Eve Beatty with Eater San Francisco. Are there specific health concerns related to indoor restaurant dining that keep it off today's list of business sectors you are hoping to reopen in September and October?
So I think if you look at the pieces that we've really released today, they fall into the buckets of the lower risk activities. And the component of indoor dining, there are a number of things that are concerning there. And just to remind everybody, outdoor dining is open and takeout is open, so certainly there are opportunities there. But indoor dining would be in a later gate at this point because of the risk that is entailed in people sitting down for long periods of time in crowded quarters, in the indoors, taking off masks. So those factors contribute to a decision to push indoor dining into a later gate. But I certainly miss going to restaurants, and if we all do our part, I think we'd all be thrilled to see indoor dining coming online sometime in the future.
Thank you, Dr. Colfax. The next question is from Heather Knight with the San Francisco Chronicle. Is there any plan for reopening kids' playgrounds, basketball courts, and other outdoor recreation options?
So we are constantly evaluating those dynamics. And one of the key things with regard to playgrounds, and I certainly would love to see playgrounds reopen, and I know many parents would as well, and certainly kids. But playgrounds are an mostly uncontrolled environment with lots of children mixing different ages, interacting with lots of different families. So that does increase the risk of transmission. And at this time, we do not have a specific date for reopening playgrounds, but our health officer and our pediatric team is looking at the data, and that is something that we would like to do as soon as it is safer to do so.
Thank you, Dr. Colfax. The next set of questions are for Mayor Breed. Mayor Breed, your first set of questions come from Heather Knight with the San Francisco Chronicle. 6 weeks after the city settled a lawsuit related to conditions in the Tenderloin, how do you think things are going in the neighborhood amid the COVID-19 pandemic?
Well, first of all, I want to start by saying we didn't just put together a comprehensive plan to address homelessness and the large number of tent encampments in the Tenderloin. We've actually spread out to other neighborhoods where we have seen really a level of homelessness that typically these particular neighborhoods don't experience as well. In the Tenderloin in particular, we saw, over 400 tents with a few hundred people. And we've been able to not only reduce that to, as of today, 41 tents, but we've also been able to get most of those people the help and the support that they need. And that includes transitioning some of those folks into some of our safe sleeping sites, some of those people into hotels, and some people into permanent supportive housing. It's easier said than done because it required a real village of people who work for several different city agencies. Our homeless street operations center, really under the direction of emergency management, Mary Ellen Carroll, Jeff Kaczynski, and others, because of this COVID crisis and because of the need to try and get people indoors, prevent the spread within our homeless population, and provide people with a safe place to sleep, this operation has been absolutely incredible. And I want to thank all of those city workers who played a role in going in and really addressing what was a real challenge in several areas, including one that was located out by Ocean Beach. There was one near the DMV on Oak Street. There was one in DuBose, in addition to the Tenderloin. And so these encampment resolution teams include workers from the Department of Public Works. They include members of the San Francisco Police Department. They include workers from the Department of Public Health and our emergency management team. And I just really want to thank them because they are out there every single day. And our homeless outreach team. When they began the resolution of trying to address an encampment site, they don't just show up the day of. They have to go in and develop a relationship with the people who are out there to understand what the challenges are that they face so that they are able to provide them the support and the assistance that they need. And that's really what they've been able to do. It is an ongoing process. It has been really the most effective thing that we've been able to do as it relates to resolving encampments, and it's something that we will continue to do. I know that so many people in this city are tired and they're frustrated. I also know that there sadly is a lot of poverty and a lack of housing and resources for so many folks. It is not easy. It is something we are working hard to address. And our program that we have established and our plan around addressing homelessness has been the most effective that it has ever been since we have put together this plan to address encampment. So it is going well. It's not good enough. And going back to the conditions of the Tenderloin in particular, it is really still horrible. I just want to be honest. You know, we may have removed the encampments, we may have helped people to get housing, but what we are seeing publicly in Soma and the Tenderloin around the behavior, the urinating and the defecating and publicly acts that are unmentionable at this time that really have impacted the quality of life for the people in that community, we see things get worse. And so part of what we are going to need to do, especially around the significant amount of drug dealing that occurs in the Tenderloin, it is just really to the point where we have got to get a lot more aggressive. You know, we can't have it both ways. You can't be upset that we're making arrests, but also be upset that we're allowing the conditions of what happens in the Tenderloin to continue. And the fact is, we have a responsibility to the people of this city. These kinds of acts should not be tolerated in this capacity. So we got a lot of work to do still, and we're going to continue to push and do our job to try and make sure that we clean up this community so that people who are walking down the street with a baby stroller, they don't have to get off and go into the streets to walk around a bunch of people selling drugs and shooting up. Is that okay for families to have to live like that? It's not. And it's something that we have to work harder on addressing. But we are in a much better place than we've been in a long time.
Thank you, Madam Mayor.
Thank you.
There are no further questions, and this concludes today's press conference. Thank you, Madam Mayor, Dr. Colfax, and Assessor Chu for your time.